Pakistan is the country which is the largest number of people migrating from any country in the world. It's Pakistan, according to the United Nations. About 1.5 million people every year leaving the country. It's still five. The average number of children in Pakistan is 3.5, which means 10 women have 35 children. In Bangladesh, 10 women have 20 children. So almost 40% higher fertility in Pakistan. According to studies done by Population Council, there are about 3 million abortions done in Pakistan every year. These are the women who wanted to use family planning methods, but they were unable to. They became pregnant and they go for abortion, and many of them die.
Hello and welcome to another episode of All Things Money. I'm your host Fatima Attarwala. My guest today is Dr. Mehtab Karim. He's the president of Population Association of Pakistan and Professor Emeritus of Aga Khan University. The topic today is population. Now, I've written a lot about population. If you want to go, you can look up an earlier podcast we did on population. And one thing that we keep being told repeatedly that it's not population that is the problem, is the resource distribution and the lack of productivity. In fact, population management itself has been receiving pushback from a lot of quarters. So, what I would like to understand, sir, is why has there been a change in understanding over the years? In the 2000s, I remember jingles, and there was a touch contraceptive ad of Sono Zara, which was very catchy, and family planning, Sab Sitara, all of that was very common. Over time, however, we seem to have changed the narrative from population management to productivity and resources. And when we do now talk about population, there does seem to be a pushback. So, what happened?
Well, one of the dilemma of Pakistan's program, population policies, that they keep on changing. Okay, that's a major problem because of which we have not been able to achieve a proper population or reduce our population growth. If you look at all the countries in Asia, starting from South Korea and up to Bangladesh and to India and to on the western side, Iran and Egypt and Tunisia and Turkey, they all started a family planning program in the late 60s, and they have done, it has remained consistent. Okay, there has been one strategy which they developed, and they said, okay, we are going to work with it, and that's it. On the other hand, Pakistan started with a boom in the 1960s under Field Marshal Ayub Khan. We had a successful family planning program for 5-6 years in the 1960s. And then came, with the breakup of East Pakistan, our policymakers decided that population is not a problem for us. We lost more than half of the population of the country, so we have a lot of land area. Why do we need a family planning program? That was in the early 1970s, and then the martial law regime came, and they decided that family planning is a no-no. It's against the Islamic teachings, and for the next 25 years or so, family planning remained, a sort of, something desirable, but not. They didn't have an aggressive program as elsewhere in other Asian countries and North African countries. And then in the late 90s, during Mohtarama Benazir's government, when she led a delegation to the international conference in Cairo, it was made clear that most of the countries have moved ahead by reducing the family plan, reducing their fertility, and have a very successful family planning program. So she came up with this idea of community health workers, lady health workers scheme, which was quite successful in the late 1990s. And then the same thing happened. Again, the new government came and they decided that no, they want a new strategy. For the next 10 years, they had jingles and everything on the program in the TV, but no reach out program. A lot of women who wanted to use contraceptives, they didn't have access, where to go. And so that happened, and then in 2012 or 10, I think, when they had this 18th Amendment, they decided that the program should be devolved to the provinces. Okay, so they keep on changing their strategy, and provinces would make their own decision. All the provinces came up with new population policy, but not implemented. You see, so we are good in making policies, but not good in implementing them. And I just saw, as a matter of fact, I was reading Dawn, and there was an editorial also, I think yesterday, the day before,
Yes,
that new policy has come out. They had one in 2018. The suo motu was taken by the Chief Justice, and they had a big conference in Islamabad. I also attended that. Many other people, demographers and policymakers were there. But 8 years later, nothing happened. And so they have a new policy, the National Population Policy Council they have formed. Hopefully, it will deliver. But to deliver, they have to have serious thinking that how to do it. We have everything is available. We have good examples from between Indonesia and Iran, Muslim majority countries. We have India. We have many other countries in Africa which have implemented successful programs. But I think it's a failure of the policy implementation and inconsistency in our program, which has left our far, far behind. Population growth rate is exceeding 2% in Pakistan, whereas most of the countries I named, they are growing at the rate of 1%. You know that our economic growth rate is what? Hardly 3%. 2.5%, between 2.5% to 2.5% is population growth rate. And so what's happening? Poverty is increasing. More people are becoming poorer and poorer. And those who gave birth, they are poorer families. So we are stuck, in a dilemma.
So when we had the solar revolution, it was a grassroots movement. The number of kids you have is a personal decision. We have discussed top-down efforts, but there are multiple trends happening on the ground. For example, women empowerment. When you talk about population, when you talk about having kids, you have to talk about women, right? If you have more educated women, they'll have less kids. If you have more working women, then they'll have less kids because they won't be able to. And the economic environment is such that even the middle income group, the women are starting to enter the workforce. There are more leaders. So you would expect the population to come down as more and more women work. So I wonder how much of it is cultural resistance. For example, the highest population we see, the highest population growth we see is from the lower socioeconomic groups. Everybody in Pakistan has some kind of household help. And if you were to talk to the household help, they'll tell you the woman will tell you, maybe I did not want kids, or maybe I have 4 daughters, I do not want to try for a son. But the kind of pressure that they are facing from their male family members, that prevents family planning. So I think we need more of a grassroots movement, more of an awareness that if you have 10 children, you cannot feed them. It's not about resource distribution. Even a fairly well-off family would find it challenging. But then again, the question is, this is so self-explanatory. Why aren't people themselves choosing to use contraceptives?
Yeah, I know. I think you have really touched a very, very important issue, which has to do with the, autonomy given to women. Let them work. And I think, you talked about culturally sensitive issues. I don't think, I have been to Bangladesh, and most of us know Bangladesh well. Mm-hmm. Culturally, it's not very different than Pakistan. Religiously, it's not very different than Pakistan. But what they did, when they became independent, they decided that their top priority is controlling their excessive population growth. And as I wrote in one of the papers I shared with you also, that in 1971, they had more people than Pakistan. Now they have about 178 million people. We have 260 million, close to 260 million people. Now, what they did, what was the miracle? There was no miracle. they made a policy decision. And that policy decision was that we must control their population growth rate, A. B, how to do it. The first thing was that give women opportunity to work.
Absolutely.
Okay. And they jumped in Grameen Bank and other NGOs who encourage women to work. Okay. And what they did, that they gave them loan, not dole, not just free money. They said, okay, this is the loan. You start your own business. If you can, you will start doing work. You start working somewhere. But in 1970s, both the countries had female participation rate in labor force was about 10 to 12%. Pakistan has now moved to about 20%. Bangladesh has 40%. Young women, they are working in factories, and they are also doing a small business. Mm-hmm. When a male member sees that a woman is bringing money and she is independent, she can make a decision that how many children she should have. And those women coming from poor families, illiterate, by the way, illiteracy rate was as bad in Bangladesh about 40 years ago as it was in Pakistan. Illiterate women living in slum areas in what we call Kachi Abadis in Pakistan. Mm-hmm. They are the ones who have led the movement in Bangladesh. Mind you, the contraceptive use rate among those women is more than 60%, same as educated women living in Dhaka. Okay, that's one thing which they did. Okay, secondly, they brought in together all the public sector departments, all the private sector, and NGOs together that you have to deliver. And they did it very, very nicely, very wisely. Within 10 years, the average number of children born to women in Bangladesh is about two, which what we call, demographers call it, replacement fertility. That means that a woman when has 2 children, that means she has replaced herself and her husband with 2 children. And that is true for women who are living in rural areas of Bangladesh and living in cities also, living in low-income families, living in middle-income families and upper-income families. It didn't happen in Pakistan. Even in middle-income families, our average number of children is about 3. Okay. And among those who are poorer, it is about 5. It's still 5. You know, the average number of children in Pakistan is 3.5, which means 10 women have 35 children. In Bangladesh, 10 women have 20 children. So almost 40% higher fertility in Pakistan. That's the reason we are having all the problems. And that problem is not only related to, of course, one of the major issues is that children born, they're very unhealthy, high level of malnutrition among children, mothers, excessive, too many pregnancies, too many childbirths. And then that's a health. Education, we know where we are. I don't have to repeat. And just look at our economic issues. You know, Pakistan is the country which is the largest number of people migrating from any country in the world. It's Pakistan, according to the United Nations. About 1.5 million people every year leaving the country. And who are they? They are mostly young workforce, either going to the Middle East. Half of them are going to the Middle East. Other half is going to Europe and North America. And so we are losing them. You know, they don't have job opportunities in Pakistan. And how do you see that? You know, it's our productivity in terms of demographic is very high, but economically it isn't. And so I'm glad that now the present government, and especially I was reading the statement of the finance minister, this is the first time the finance minister has spoken that this is the major economic problem, the population growth, high population growth rate, which Pakistan is facing. Inflation, just look at the rate of inflation in Pakistan, very high. What is when I read, as undergraduate, we read that too few goods being chased by too many people. That's inflation. Okay. On the other hand, just look at our per capita income. We have hardly about $1,800 per year per capita. Bangladesh is about 2,800. Bangladesh was almost half of Pakistan's per capita income about 40 years ago. India was behind Pakistan, and all of them have gone ahead. They are doing better. And I see that it has to do with too many people. Of course, our resources are limited and being divided by too many people. So that is per capita income, obviously. So look at people migrating to the cities. You and I live in Karachi, and see how many people are moving there from villages because there are no job opportunities. The people who are living in villages, lands are being fragmented, too many children being born. So they divide the land, and there's not enough opportunity for people to earn. So they move to the city, illiterate workforce, moving to the large cities like Karachi, Lahore, Faisalabad, Rawalpindi, and other places. And there's overcrowding. Just look at infrastructure. What is happening? What's happening, and everybody talks about poor infrastructure of Karachi, and it has to do. They blame the government. Of course, partly government is to blame, but they are also have to see that how many people are migrating to the cities because of excessive birth rate in the rural areas. So that all boils down to we have to control the faucet somewhere. And if you are unable to do that, I recently, for Planning Commission, about 5 demographers from various parts of Pakistan, we got together, we sat together for almost 1 year, and we have looked at where the population growth is going to go in Pakistan. And it's, not a very good scenario that by 1947, we will have so many people getting close to about 380 million people would be there in Pakistan when Pakistan celebrates its 100th birthday. So unless until we are, and that is, by the way, even we have been able to reduce our population growth rate. Then, if we don't, then it would be much worse. It could be double than what we have. It could exceed 400 million people. So something has to be done. Now, I'm glad that, a channel like Dawn, a newspaper, which is very, it looks into social issues very, very closely. It is taking interest. I attended the summit last year by Dawn, very successful summit, but the government's participation was not very encouraging. The Prime Minister didn't show up. He was supposed to.
The government's participation, I do believe that there is a certain amount of lip service being paid, and we are having this conversation. Dawn is talking about it. But again, in the scenario that you painted, you have the poor people coming from the rural areas to the urban areas. So let's imagine there is a woman, she's working as a Masi, the typical Masi.
Right.
Minimum wage is not enforced. She works 2 houses. Maybe she gets 20,000 from one, 15,000 from another. That's 35. Her husband works as a guard somewhere. He gets 30. So that's what, like 65,000. If they have 5 kids, how are they going to feed them, much less educate them or clothe them?
Sure.
Those 5 kids are going to perpetuate their poverty. Those are the people that need to be reached out to, and our campaigns and our conversations, they won't reach them. So how do we reach them? Because they themselves need to realize we cannot have more kids. These are more mouths to feed, not more hands to do work or earn a living. Because then we have all the chotas in the workshops, and then we have if you're in Karachi, you would see such small kids in the age of 4 dressed in golden like a statue, and you can't even help them, because if you try to help one, a dozen others will come.
And then many of them also begging. You go
They're
to,
begging, yes.
yeah, I know, they
And the,
come and do begging. As a matter of fact, Pakistan has become notorious that beggars are also going abroad to the
yes,
Gulf
we are
countries.
not getting
Yeah,
visas. Our passports are being
sure.
blacklisted because they're accepting
No,
beggars.
let me go back to the policy adopted by, I did mention about Bangladesh, so I don't want to repeat that. But let me go back to the policy adopted by our government, during Mohtarama Benazir's government in 1990s, about 94, Lady Health Worker Program. That was a very successful program. The contraceptive use rate shot up from 12% to about 22% in 2, 3 years, because they were able to reach out to women house to house. The new government came in and they changed the policy. They were transferred to the health department to deliver polio vaccines and whatever. Okay. So their priority was changed. Okay. Now, I say one thing which is kind of, very important, but it could be, I hope it is not controversial. We have so many women under the Benazir Income Support Program. They are being supported by the government. They're being given dole. They're giving some monthly allowance of few thousand rupees, which is not enough. But they are the one who most of them are living in villages. There are no families there. They could be used the way Grameen Bank and NGOs in Bangladesh use women to first that they themselves are promoting family planning activities, and secondly, they can reach out to their neighbors. I think we have such a huge force to do this work because, see, what we call is unmet need. Unmet need means that married women who want to use contraceptives. In the surveys after surveys, they're about 20%, close to 20%. They say, yes, they want to control they don't want to have that many children and they want to do family planning, but they don't know where to do it. You see, you talked about cultural sensitivity. Our family planning centers are located at places where women themselves don't want to go there. One. And secondly, they are located in far-flung areas, in villages. Unless until there's an outreach whereby these women could be contacted at home as lady health workers are contacting women for polio vaccination and other vaccination. Why can't they do the same thing for family planning services? They were supposed to originally, and they did in 1990s, as I mentioned, early 90s, and now they're not doing it anymore. And so this huge number of women, some of them are also young, married, majority of them are married, some are widowed. They all can work as a force, and family planning program can give them extra allowance to do this work. I'm not saying that get the work free from them. So that kind of, and these, the masses you have been talking about, see, just one thing very, very, important to note is that according to studies done by Population Council, there are about 3 million abortions done in Pakistan every year. These are the women who wanted to use family planning methods, but they were unable to. They became pregnant and they go for abortion, and many of them die. Pakistan has very high maternal mortality rate also. So they go for illegal abortion because abortion is not legalized in Pakistan. And they are mostly from poor families. So many things could be done to overcome this population growth rate if there is a way. If there is a will, there is a way. So I'm glad, as I mentioned again, I would like to repeat it, that new policy which they have come out with, the top priority should be implementation. Absolutely. We know what to do, but we have not been successful in reaching out to those women. Unless until we do that, things are not going to improve. And I'm concerned, as you are, the program is about the economic issues, that we are just being left behind by many countries, which were worse off than Pakistan. And just look at the Human Development Indicator of Pakistan. Human Development Indicator is what benchmark for three indicators: health, which is infant mortality, measured as in the level of infant mortality. It's twice that than that of Bangladesh, by the way. Just imagine, it's twice that of Nepal and India. We are in the neighborhood, same neighborhood. Then our per capita income, which is lower now than Bangladesh and India, and thirdly, our literacy rate. People, young children who are unable to go to school. As you know, that we often talk about. I've been hearing about this 26 million children out of school. Perhaps it must have gone up more than 30 million by now. So because the numbers are increasing, they are the one who are
That's more than
being
the
born
population
in
of
poor
Australia.
families, and they are not, you ask, personal level, when the Masis come to work at my place, I ask my wife to ask them that if the children are going to school. No, they're not going to school. So I pick up, that's also my mission, that my wife and I will try to finance them. Okay, as much as we can, send them to school. But how many I can, perhaps my family can support 2 or 3. And maybe there are people like you and many others can do that, but there are hordes of them. There's so many, and they are busy. And some of them, they want their children to work, so they don't want to send them to school. They say the easy money, they're bringing money. They're bringing a few hundred rupees per day by doing some odd jobs or begging or whatever. It depends which family you're talking about. So that is a very, very crucial thing. One has to do something about it. And we are
Absolutely.
talking about
So you
not,
mentioned
if you start like it's a train, it's something somebody has said very nicely, that if you take a break in the train, it's going at the speed of 60 or 70 miles per hour. It doesn't stop immediately. It takes a while. It takes almost half a mile for the train to stop. So if we start implementing a program now in 2026, it will take 4 or 5 years before that we are able to control our population growth rate.
But as you mentioned, sir, it comes down to implementation. Now, we talk about Bangladesh, then we can look at exports. Our exports used to be more than Bangladesh. We had an export policy. It wasn't implemented. We could keep talking about a lot of policies that are not implementation. We make a lot of policies, but implementation has always been where Pakistan lags. I think the point that you made about community initiatives makes a lot of sense, because women understand other women's problems and they can talk in the same language, in the same lingo, and touch on really, I mean, it's such a sensitive topic when you go into contraceptives and how to use them and what to say to your husband and how do you manage that family. It has to come from lady head workers and community initiatives. It cannot be, okay, we have decided that Pakistan will not have a larger population. It is women to women contact that it can bring it down. But then again, our polio vaccination program has not been able to eradicate polio despite millions of dollars of funding, despite so many years of efforts. So it again comes out on how effective that implementation is.
Yeah, as a matter of fact, there are certain sensitive areas related to polio, but as people have been reacted in certain communities against polio, fortunately, there has not been a resistance against family planning workers.
So
That's a
I
good.
promise you, even when this video goes up, there will be comments under it explaining why more children are good. They will talk about the demographic dividend, even though the kids are stunted, and there's malnutrition, there's illiteracy, there are no jobs. They'll talk about, look, China and India have such massive populations, but they are successful without looking at the fact that India's fertility rate is going down. China had the one child policy. Once this video is up, you should read the comments and understand how even the educated Pakistan is not that pro family planning as they should be. I mean, I was blown away the last time I shot a video like this. That there's so
Yeah,
many people
it's very
against it.
unfortunate. Of course, there would be always people talking about that, but they don't perhaps see that if you look at the demographic dividend, doesn't only mean that too many people. That means they have to be well trained. Just look at our uh, level of education in Pakistan. I'll just give you one example. I'm not this coming comes out of my own work. I'm comparing different Muslim countries. In Turkey, about close to 40% of young people who are university or college going age, which is between 17 to 23 years of age, about 40% of them attend universities and colleges. Okay. In Iran, about 36%, 37%. In Egypt, about the same, in about 35%. In Bangladesh, about 18, 19%. In Pakistan, only 9%. This is the UNESCO statistics taken from the different censuses. Okay. This is, they don't rely, I mean, they don't generate their own statistics. It's taken from national data. And look at that. So where is the demographic dividend? If only, I know I tell my students that you're very, very lucky that you're 1 out of 10 among your peer, that you are attending a university. And 9, they don't make it to college. They're 9 out of 10, they don't make it to college. Just look at our primary school attendance. It is what, 65%? Bangladesh has what, 90%? Sri Lanka has 95%. With all the countries around us, they have very high level of primary school attendance among those kids who are 5 to 9 years of age. And when they reach secondary level, which is 10 to 15 years of age, in Pakistan, only 22% have secondary level of education. So if there's no education, where is the demographic dividend? China did it by first educating their masses. Indonesia, India, they're all much ahead of Pakistan. And just look at that our the educated people we have, we are exporting them. So we would be left off with the people. I don't know, when I see some young talented people like you or your generation, they're working in Pakistan, but many have left the country, are leaving the country.
Anybody working in Pakistan, 95% are because they haven't gotten the opportunity to leave, not because they want to stay.
Right.
I mean, like Karachi is one of the least livable cities in the world.
Sure,
How
I
do
was
you
just
even get there?
right. I did a survey of my student. I asked my students, I teach a course in research methods, and I asked them to do a survey of young people or whatever they want to. So they did a survey of students in different universities in Karachi, okay, about 2 years ago. And one question was asked that after graduating, would you like to leave the country or to work abroad? Majority of them said yes. If opportunity comes, I will go. I'll give you an example of Aga Khan in medical school, where I've been teaching for many years. Out of 100 graduates they produce, I think 90 of them leave the country.
90 graduates of Aga Khan
90
leave the country
graduates
out of 100.
They leave the country. Some of them come back, but I think 80%, the largest number of Aga Khan Medical School alumni, I go and attend, and I'm in the States nowadays, and I meet them. Everywhere they're there. They're doing extremely well. I'm not talking. And same is true for the top class of Daw Medical College and King Edward Medical College, all over there in Pakistan. Apna, Association of Pakistani Physicians, is in North America. It's a huge gathering every year. They're all Pakistani medical graduates. I was reading a very interesting article in which appeared in Dawn, I think, this last Sunday, about the students from LUMS. This Sunday, I think it was students from
I
LUMS.
have missed it.
They are also leaving the country. They are working abroad, majority of them.
I'm from Lum, so I haven't been able to leave the country.
No, but you see that article. Those people,
Yes.
see, some people have, personal issues. They don't want to do. For example, I came, I
But
studied
you're
in
right.
US. I went
Localized,
back because I wanted
any
to be the.
top tier university, their graduates would want to leave. That's why we would go to such a top tier university and pay the big bucks in the hopes that you'll land a job abroad.
Right. And secondly, people who do want to stay in Pakistan, they have also personal issues, parents, peer
Parents, yeah.
pressure, and what have you. So that's, of course, I'm not saying everybody wants to leave, but those who want, those who can,
Those who can,
those who can,
those who have the job opportunities,
so
yeah.
what is happening that we are having, it's not the talent, but, just I was reading the statement by the Prime Minister and Chief Minister of Punjab. No, I have no political affiliation. Both of them made statement that our people should go and work abroad. I don't know if you read that.
Because we depend on remittances, right?
Because remittances, they are the major
Yeah.
foreign exchange earners for the country.
Why manufacture and send exports when you can just send people and get remittances?
So
Zero
our
effort.
major reliance, even at the policy level, at the top level, it is that we should have more people. And unless until they change that policy, okay, things are not going to get better in Pakistan. We have a lot of issues emanating from excessive population growth, environmental issues. We have crimes. Add on and on and on, and you will see that you read papers. Many people have written about many countries that this is, what's happening in Pakistan. It has has to do with. I'm not saying everything has to do with overpopulation or overpopulation growth, but it has a lot to do with excessive population we are having, whether at village level, whether in Kachi Abadis, whether in cities, whether in small towns, all over.
Absolutely. So I think you've hit the nail on the head that without implementation and awareness, almost every problem, economic problem, social problem that Pakistan will have, it will get worse. Because the more the people, the less the resources per person. Thank you so much for your time, sir. I hope that people who watch it, even if some people are convinced to have less kids, I think this was time well spent. Thank you so much for being on the show, sir. And I hope that you have a fantastic weekend ahead.
Thank you very much. Thanks for having me. For a long distance, even though I'm in the US, but I'm concerned about Pakistan. Currently, I'm doing research on Pakistani diaspora in US. It's very interesting. They're, highly educated. I'd like to mention that we are talking about exporting people. The level of education of Pakistani diaspora, the people who have come from Pakistan, and their children, is better than the white Americans, by the way. I'm quoting the US Census data. They are doing extremely well. And so I feel that we are losing the talent from Pakistan. If they had good opportunity in the country, they would stay there.
They would. Even if there was hope for the future, potential for improvement, I think people would stay. But repeated cycles of political instability, economic instability has made it difficult to lean into the natural patriotism that we all have. Like you are sitting in the US, but you still feel for Pakistan, you still want to help Pakistan. But if there's nothing left there for families, if there's no better future for your own family, then obviously you'll try to find a better future.
You see, I feel sorry for young people, because many of them, I meet the students and I go to lecture, they talk about Pakistan and they're concerned about Pakistan. But there's a feeling that things need to be improved there, economically, socially, and demographically. And as a demographer, I think that's the top priority, unless until we are able to address this population issue. We are going to going to have more problems in future Unfortunately, what we say, Khuda na khasta. Let's see. Let's hope that things get better.
Let's hope for the best. Thank you so much for your time. So thank you for coming on the show.
Thanks a lot. Good talking to you.
Good talking to you too.